Hello, good evening, everyone. Today we are going to talk about something which is very commonly asked. Every alternate day, one of the candidates is texting me, like I'm going to sit for the Section 1 FRCS, what should be the resources? I'm going to sit for the Section 1 FRCS, what SBAs, what MCQs, where should I find the SBA type of questions which are asked? The answer is there is not a single resource available which could help you in your Section 1 preparation exactly the way the pattern the exam is being conducted. You will only realize once you have appeared for the exam that the resources which are available are not updated to the exam format. Most of the questions which are available are not updated as per the guidelines, and even the questions are not the way the exam is conducted. So let me tell you how the exams are conducted. The exam is based on your concept-based understanding. So they want to test whether you are able to detect a change, significant change in a urodynamic, whether you are able to identify an important finding in an MRI, whether you are able to identify the level of the thrombus, whether you can know the next best step of management that shows how safe you are, how your presence of mind is. So there are scenarios based on all of this. Okay, so there will be certain trials which are being asked, there will be certain drugs. It's not entirely a concept-based paper. It's going to be a mixture of all of them. They're going to ask you some fact-based questions as well, like they were going to ask you about the T-half of certain drugs, about the mechanism of action of certain drugs, about the complication of transplant. And there could be a lot of questions, different types of questions, but there will be not a single resource which is going to cover your entire thing. This is the problem that most of the candidates face, and this will be there for the coming years. Now, what we are trying to do when we are discussing a session in our class, what we do is we take up the questions related to that case. For example, we are discussing a bladder cancer. So we take all the possible scenario, possible MCQs or the single best answer type questions with 5 options, like which is going to be the best answer. And we actively involve the candidates to participate in that. And this definitely has helped a lot of candidates who have appeared for the exam in the previous July and the September exam. I'll show you exactly what I'm trying to explain. During our sessions, we also conduct mock exams. And when you give the mock exams, you will realize, so we don't encourage discussing the recalls. We are not discussing the recalls. We are just discussing exam type format. So we should be aware of the exam format, and there is no MCQ resource which is going to help you in understanding the exam format. So to help you in this understanding, we have started, I'll share you the screen. If you go through this website, I'll share you the link in the website. This is my website where we have started an FRCS Section 1 mock exam. So for all the candidates who are preparing for the mock exam for the Section 1 urology, definitely for you, the mock exam is absolutely available on the website. You go click on this link. Once you click on this link, you will get certain instructions. Then the timer will start and you have a mock exam of 50 questions. You will understand the pattern of questions which are being asked in the exam. So there are compilation of simple questions. There are going to be compilation of difficult questions and some image-based questions, some concepts, and some factual questions, as I said. So there will be a mixture of all the questions, and it's not going to be a 240 questions exam like you actually get on the exam day. This is just for you to understand that how the exam is being conducted, what kind of questions you are going to get, and it's not a recall which is being produced. So I don't encourage discussion of recalls. Again, I repeat that. So you go to the website, click on the link. This mock exam will be available for the next 5 days. So take your time. It's going to be just take 1 hour. Know where you stand in your preparation. Know what kind of questions are being asked. And this is going to help you a lot in the preparation. Okay. What we do in our sessions, in our daily sessions, we have 16 sessions to cover in our Section 1 course where we take up MCQs. So every day we discuss around 20-25 questions where we take up questions from every section that we discuss. For example, we are discussing a functional urology. We take up different types of urodynamics and try to solve the different possible questions which are being asked. We also take up, for example, like the andrology. We take up scenario, for example, a Peyronie's disease and what are the questions which can be asked. So our whole aim is to make you aware of the exam format, which has changed over the years. Okay, there are different resources available. I'm talking about the standard resources now. That is the Oxford, the scientific basis, and the EAU guidelines. And there is some other resources like the British medical best medical practice. There is again one more resource like NICE guidelines. I was forgetting that. So not everything is updated, but you should know which topic to study from where. I'm going to help you with all this. try to solve this question. You will know what is your level of preparation. And if you need any help, let me know. We have the website link below in the description. Please go to the link and solve these questions. This is really going to be helpful. Thank you so much. Let me know if you need any help.